Hypertension, better known as high blood pressure, is a global health crisis. In the US alone, nearly half of adults are affected, and the scary part? Most don't even know they have it. That's why it's called the silent killer. No symptoms, no warnings, just an increased risk of heart disease, stroke, and even kidney failure. But what exactly is hypertension, what causes it, and how can you prevent it? Let's break it all down. Hypertension happens when the force of your blood pushing against artery walls is consistently too high. This puts extra strain on your heart and blood vessels, leading to severe health complications over time. Blood pressure is measured using two numbers: systolic, the pressure when your heart beats, and diastolic, the pressure when your heart rests. If that top number hits 130 or higher, or the bottom number reaches 80 or more, you could have high blood pressure. The biggest issue with hypertension is that it doesn't usually cause noticeable symptoms. You could be living with dangerously high blood pressure for years and not realize it until it leads to a major health event like a heart attack or stroke. That's why regular checkups are crucial. Imagine driving a car with failing brakes. You wouldn't know there's a problem until you're already in danger. Hypertension is incredibly common. About 1.2 billion people worldwide between the ages of 30 and 79 have high blood pressure, and 2 out of 3 of them live in low or middle-income countries. In the US alone, around 116 million adults are affected. In 2020, high blood pressure contributed to over 670,000 deaths in the US, a number that keeps rising. To put that into perspective, that's more than the population of some major cities. It's a silent epidemic that demands more awareness and action. The two types of hypertension. First, primary hypertension. This is the most common form and develops over time due to lifestyle and aging. And secondary hypertension. This is caused by underlying conditions like kidney disease, sleep apnea, or certain medications. Both types can exist together, making it even more important to stay on top of your health. Even if you start with primary hypertension, an undiagnosed condition could make it worse. Many factors can contribute to high blood pressure, including a diet high in sodium, lack of physical activity, excessive alcohol consumption, obesity, genetics. If close family members have high blood pressure, your risk increases. Chronic conditions like diabetes or kidney disease. Age, risk increases after 55. Chronic stress. Hypertension doesn't just raise your blood pressure. It can lead to life-threatening conditions like heart disease, stroke, kidney failure, vision loss, vascular dementia, pregnancy complications. Think of it this way. Your blood vessels are like pipes. If the pressure inside them is too high for too long, they can weaken, burst, or become clogged, leading to devastating consequences. The only way to know if you have hypertension is by measuring your blood pressure regularly. You can do this at your doctor's office, a pharmacy, or even at home with a blood pressure monitor. If your readings are consistently high at 2 separate appointments, your doctor will likely diagnose you with hypertension. The good news? Hypertension is manageable and in many cases, preventable. Here's how. Adopt a heart-healthy diet. The DASH diet, rich in fruits, vegetables, whole grains, and lean proteins, is a great choice. Exercise regularly. Aim for at least 30 minutes of moderate activity most days of the week. Reduce salt intake. Too much sodium can raise blood pressure, so opt for fresh foods over processed ones. Stop smoking. Smoking raises blood pressure and damages blood vessels, increasing the risk of hypertension and heart disease. Maintain a healthy weight. Shedding even a few pounds can make a significant difference. Monitor your blood pressure at home. If your doctor recommends it, keeping track of your numbers can help detect issues early. Manage stress. Practices like meditation, deep breathing, and getting enough sleep can significantly lower your risk. And why potassium essential? Potassium can help counteract the effects of sodium. Foods like bananas, spinach, sweet potatoes, yogurt, beans, and many more are excellent sources. Experts recommend aiming for 3,500 to 5,000 milligrams of potassium per day through food rather than supplements. Now, the question is, when should I see a doctor? If you experience severe headaches, chest pain, shortness of breath, blurry vision, or sudden anxiety, seek medical help immediately. These could be signs of dangerously high blood pressure. For regular checkups, ask your doctor about your ideal blood pressure range, lifestyle recommendations, and whether medication is necessary. Although the risk increases with age, young individuals can also develop high blood pressure, especially if they have risk factors such as obesity and an unhealthy lifestyle. Hypertension is a silent but deadly condition. The key to protecting yourself is awareness, early detection, and proactive management. Check your blood pressure regularly, make heart-healthy choices, and consult your doctor if anything seems off. Your future self will thank you. Stay informed, stay healthy, and take control of your blood pressure today. Hope you found this video helpful and gained valuable insights. If you enjoyed it, don't forget to like, share, and subscribe for more content. Drop a comment below with your thoughts or questions. I'd love to hear from you. And see you in the next video.